Direct-to-patient telehealth is a distinct form of telehealth where the patient initiates video-based care from any location to a medical provider or clinic. This differs from standard telehealth where the clinic initiates the visit on behalf of a patient, connecting clinic to clinic. In the setting of the COVID-19 pandemic, a key change implemented by health systems was the rapid expansion of telehealth using patient web portals to try to maintain healthcare access. At the beginning of the pandemic, few pediatric patient families at Vanderbilt had signed up for the patient web portal. The United States Department of Health and Human Services began allowing for an expansion of remote communication platforms, which were previously not allowed. Through this new policy of platform flexibility, we were able to observe how direct-to-patient video telehealth in primary care affected use in diverse pediatric populations. Using quantitative and qualitative data, this study examined telehealth video visit use for Medicaid-insured pediatric populations in the early COVID-19 pandemic and compared the experience of English speakers to non-English speakers. At the Pediatric Primary Care Clinic at an academic center in Nashville where the study took place, the majority of the 19,000 patient families are insured by Medicaid, with a large percentage having a preferred language other than English. Faculty and residents completed an electronic survey after telehealth visits that included questions on provider role, visit type, patient language, use of an interpreter, and the platform and device used. Providers were asked to rate the ease of the visit process and video image quality on a scale from 1, not at all easy or not good, to 5, very easy or excellent. Providers responded to 2 open-ended questions through free text. One was on patient family feedback, including dislikes, likes, barriers, facilitators, and suggestions for improvement. They were also asked to provide their own observations, tips, and or frustrations about the visit. Group comparisons tested if platforms used for the visit and other survey responses differed by patient language spoken. Table 1 groups telehealth visit characteristics by English and non-English speakers. A comparison of the languages spoken at in-person versus telehealth visits in April and May 2020 in Figure 1 shows overrepresentation of English language telehealth visits at greater than 80%. The majority of visits were conducted with a mobile phone. Over half of English speakers used the patient portal specific to the institution, My Health at Vanderbilt, for telehealth visits, compared to the majority of non-English speakers who did not. Instead, they preferred platforms like Zoom, WhatsApp, and FaceTime. This difference in platform use was statistically significant. Provider responses of 4 and 5 were classified as positive ratings. Positive ratings of 4 or 5 for processes and video quality were significantly more frequent for visits in English compared to those in another language. Figure 2 shows a conceptual framework of the telehealth experience based on qualitative data. Elements contributing to visit satisfaction include family call environment, technology experience or process, value added versus in-person visits, and types of barriers present. Satisfaction was based on convenience, easy communication, completing a visit successfully, and being able to learn more about the family and home environment. This study defines opportunities and challenges for telemedicine use in diverse pediatric populations. Direct-to-patient telehealth visits enable us to connect to families within their home, saving travel time and reducing infection risk. However, there are challenges affecting these families' access to and quality of telehealth, such as language barriers, digital literacy, and home environment. Data suggests that non-English speaking patients use direct-to-patient telehealth disproportionately less than English speakers. While most patients own digital devices and had internet access, many had difficulty navigating the patient portal and therefore use alternative platforms. This study emphasizes the opportunities of direct-to-patient telehealth if accessible and designed with diverse patient populations in mind. Telehealth provides efficiency to patients and greater understanding about patient context for medical providers. Going forward, when establishing telehealth processes, this study highlights the importance of building digital health that is user-friendly when accessed on mobile technology, facilitating patient-preferred language, and simplifying logistical processes during telehealth visits. Thank you.